Okay, what I wanted to ask about was, it's 4 weeks today that I had that surgery done, and I
Oh,
still
yeah.
have a slight hematoma still
Okay.
at
Is it,
the,
has it gone down though? It's
yeah,
it's
it's
getting less.
gone.
Yeah. Yeah. Okay.
It went, week 3, I guess around like 2.5 weeks, it was about a quarter size, at least like a walnut quarter, and then it went to, almost in a week to a dime size.
Okay.
But it still is, it's still there. So what I think between having to keep my head elevated and all that, my whole head seems really hot, and I feel like I have a lot of inflammation, so I'm not, maybe that's the heat I'm feeling from my head, but everything just,
Yeah. Boy. I mean, hematomas, they do take a while. And so, but that it's on your head.
kind of my head and jaw area, because that's where that
Yeah.
surgical, and so the hematoma went to the lower incision that was down there, it went to the lowest point. So we've got gravity going there too, it's.
And how is pain levels? Like, I'm just curious, like what's pain level?
If I try to do like a lymphatic drain or something, it'll bother it. Okay. If I just lightly massage it, it can kind of tolerate that just with the lightest, but not the hematoma itself, just some of the surgical above it, But sometimes it does hurt still by my ear canal, and I don't know if that's a tendon that runs along there, but also that's a lot of the surgery.
It's probably a nerve getting irritated. I mean, it could be a tendon, it could be muscle, could be. So it's reducing.
Yes.
Let me just look something up here. Yeah, I mean, honestly, I just keep with the helichrysum. Like, I was looking to see if there's something we could add to it, and even with what I have written for just like really chronic, like slow, we had tried several different things, and nothing worked as good as the helichrysum. And so I would just stick with the helichrysum.
Okay, don't add anything per se to that.
No, I would probably just let it be by itself. Like, I mean, you can do a little bit of neat and then a little bit like in a lotion or a massage oil just to let it linger there a little bit longer. But other than that, I wouldn't change what you're putting on it.
Okay, and I had wanted to buy some Palo Santo. Which one would I get?
The regular Palo Santo. Like the fruit it's good for certain kinds of psychological things, especially like deep-seated fears and things, but it's a little bit different than the wood, which is the normal Palo Santo, and it is very good for releasing fascia, connective tissue and everything, but it's not quite the same for like doing cleansing and purification and the things for like pain and stress management and so I would just get the regular Palo Santo.
Would the fascia be irritated from that surgery in my face though?
It actually would, but for like with everything going on and that it's on your face, I'd still stick with the helichrysum for that. The helichrysum will actually help that. Yeah.
I appreciate it. Thank you very much.
Yeah, you're so welcome. Like if it was on a different part of your body, like after the hematoma went away, I'd say we can mix it up and we could do these other things. But because it's on the face, I would just stick with the helichrysum.
Okay, very good.
Perfect. Keep